So everybody's probably been to the doctor whenever they're feeling pretty crummy, maybe the walk-in clinic. And whenever you get there, you'll tell your doctor about your symptoms. I have a sore throat or I have a lot of congestion, and they'll check, they'll look in your ears, they'll look down your throat, maybe they'll check for your breath sounds, and then they'll probably prescribe an antibiotic. And you'll probably take the antibiotic for, a couple days, and you'll start to feel better. So you think, I don't need this, I'll just throw it away. Or you will save it because for the next time that you're sick. But in fact, everything in this scenario is actually contributing to the dangerous problem of antibiotic resistance. And the solution to this problem is multifaceted in that it includes changing the practices of doctors as well as the habits of patients. So you're probably wondering why I can even tell you about antibiotic resistance, but I have actually taken several classes that have taught me about it, and it inspired me to be fascinated with it, so I've done a lot of research on my own. The problem that I found that often happens is that doctors will prescribe antibiotics for viral infections, and antibiotics are 100% ineffective in treating viral infections. They're only used to kill bacteria. They can only kill bacteria. And about 1/3 of antibiotics that are prescribed are unnecessarily prescribed. And that is found from surveys from the World Health Organization as well as the CDC. Antibiotics are overprescribed due to both the patient pressuring the doctor into giving them an antibiotic because, I'm sick and I need to get better fast, so just go ahead and give me an antibiotic. Or the doctor not testing the patient to see if they are virally or bacterially infected. In fact, 60% of primary care physicians don't test the patient to see what they're infected with, and that's according to the National Ambulatory Medical Care Surveys and the National Hospital Ambulatory Medical Care Surveys. In fact, only about 10% of sore throats are bacterial infections. So most of the time whenever you have a sore throat and you're given an antibiotic, you don't need it and it'll be ineffective. If you take an antibiotic and you don't need it, what happens is the antibiotic will kill all the bacteria in your body, which may sound good, but it leaves you susceptible to being infected with antibiotic-resistant bacteria. And that gives the resistant bacteria more room to grow in your body, and it can really flourish in your body then. Antibiotic-resistant bacteria have become more and more prevalent as the years go by, and it's making the medicines that are commonly prescribed less and less effective, especially than what they used to be. And it's especially affecting things that are common infections, like sinus infections and, ear infections, bronchitis. Another problem that causes antibiotic resistance is the misuse of antibiotics by patients. So we are actually part of the problem. It's not just doctors. People are often, whenever they're prescribed an antibiotic, they'll take it until they feel better. And then whenever they feel better, they'll throw it away, even if you haven't met the 10-day prescription. But the 10-day prescription is used to kill all the bacteria in your body. And so you need to take it for the full 10 days because it leaves you susceptible to growth of resistant bacteria. And then they'll either throw it away or maybe they'll keep it for the next time they're sick. And they'll think they have the same sickness as they did the first time, but really they probably don't, and the antibiotic is completely ineffective. So what do you think the solution is to this? All primary care practices should implement in-practice testing, in-practice microbiological testing to determine what is affecting a patient before they prescribe an antibiotic. And patients need to change their habits whenever they are taking an antibiotic. So testing can be done either with a microbiologist or a qualified lab tech that can work in a doctor's office, and they can do the testing pretty fast to determine what's infecting you and determine if you need an antibiotic or not. Or you could have blood tests done and sent off. So if you do the blood test, you will only have a difference in about 1 day of getting your antibiotic. You might get it on Tuesday instead of Monday, but that day is actually worth it because you'll know that the medicine you're taking is helping you and not hurting you. So what can patients do to lessen the effects of antibiotic resistance on themselves and on those around them? So we as patients should always ask to have tests done before we are given an antibiotic, so that doctors will start, getting in the habit of testing patients, and they'll see through us that we want an antibiotic only when it's effective. Patients can also educate themselves in proper use of antibiotics. So you should take it for the full 10 days and get the full use out of it. Take it, at the times of day that it says to take it as best as you can. And we should also not save our antibiotics for later use, because that's also contributing to the spread of antibiotic resistance. We should never pressure our doctors into giving us antibiotics, because that's just hurting ourselves as well as others around us. So in conclusion, we've learned about the problem of antibiotic resistance and that it's caused by both patients and doctors. No one person is to blame, but we can make a difference through changing our habits and from doctors changing their habits. I challenge you to change your antibiotic habits, to take it when you should, not to pressure your doctor, to do all of the things that we've mentioned to lessen the effects of antibiotic resistance on yourself and on the people around you.